At the Millennium Summit in September 2000, the largest gathering of world leaders in history adopted the United Nations Millennium Declaration, committing their nations to a new global partnership to reduce extreme poverty and setting out a series of time-bound targets with a deadline of 2015, which have become known as the Millennium Development Goals. The Millennium Development Goals (MDGs) are the world's time-bound and quantified target for addressing extreme poverty in its many dimensions: income poverty, hunger, disease, lack of adequate shelter, and exclusion, while promoting gender equality, education, and environmental sustainability. They are also basic human rights, the right of each person on the planet to health, education, shelter, and security. The world has made significant progress in achieving many of the goals. Between 1990 and 2002, average overall incomes increased by approximately 21%. The number of people in extreme poverty declined by an estimated 130 million. Child mortality rate fell from 103 deaths per 1,000 live births a year to 88. Life expectancy rose from 63 years to nearly 65 years. An additional 8% of the developing world's people received access to water, and an additional 15% acquired access to improved sanitation services. But progress has been far from uniform across the world or across the goals. There are huge disparities across and within countries. Within countries, poverty is greatest for rural areas. Sub-Saharan Africa is the epicenter of crisis, with continued food insecurity, a rise of extreme poverty, stunningly high child and maternal mortality, and large numbers of people living in slums, and a widespread shortfall for most of the MDGs. In 2008, the FCT MDGs Project Support Unit commissioned a multivariable baseline survey to determine the accessibility to primary health care services. The findings of this survey were shocking, as only a paltry 26% of the 858 FCT communities had primary healthcare facilities, to which only 17% were functional, with 336 of these communities having no access to healthcare. The total number of PHC facilities was 179, a far cry from the World Health Organization's minimum requirement of 434 PHC for the territory. It was therefore cost prohibitive to construct the needed number of PHC facilities to meet the minimum requirement. Also notable from the survey was the high poverty level in the FCT, as only 2% of residents earned above 50,000 naira per annum. With these startling statistics, the attainment of the MDGs 4, 5, and 6 was definitely a mirage. These challenges resulted in the birth of Melafia, a local parlance for he who brings health. On May 29, 2009, approval was granted for the deployment of the Mobile Health Team Strategy with public-private partnership with Intel Corporation, the world leader in silicon innovation in the FCT, to alleviate the sufferings of the FCT residents, particularly the poor rural dwellers who had a wide range of health services access impediments, and to enrich the primary healthcare database and fast-track the attainment of Goal 4, 5, and 6 of the MDGs. It was launched on 7th January 2010 by the FCT minister, and the program recorded outstanding success.
Melafia has been able to impact on the community because there was no such program in the last 3 years. You know, when we started, people felt it's going to be a failure. But if I tell you, in the last 3 years, Melafia was able to use about 600 million naira. You know, that's the total cost for healthcare service delivery to these 3 to 6 communities. Whereas in the PHC, the 6 area councils merged together per year. As last year, they were telling me about 3 billion naira. So it is cost effective. It is cost effective. And what we did again, the Pan-African Health Summit, that's the first of its kind in Nigeria, was done. You know, we hosted some countries here, you know, and the participants, when they went to the field, they were like acknowledging, yeah, this is a very good innovation. And last year, the Honorable Minister of Health actually gave us the best rural healthcare practice, you know, because he made a comment at the 55th session of the National Council of Health that if it is possible, he will enjoy all other states to emulate FCT, because of some standing achievements.
From the data we've been able to collect, we are still collecting, you can see a large number of persons have been attended to in this, be it the static, which is the PSC, and the malaria. Even immunization coverage has actually increased in some of these primary health care centers that people don't really visit before because there are no facilities, there are no drugs. So a lot of improvement has actually been seen. We are collating data. In fact, we have just engaged some people to conduct a kind of research for us to see where we are in terms of what we've been able to provide in these rural communities. And by the time the reports get to us, we should be able to analyze and see where we need to add our strength and provide additional funding so that people get service to it.
MLIFA is a mobile integrated primary healthcare intervention program with an e-health component designed to provide integrated PHC services to rural, lowest, underserved, poor communities, particularly those in remote and difficult to reach settlements. It could also be regarded as an operational research where qualitative PHC services are delivered, while useful data is collated for analysis and interpretation towards influencing future health planning. Each team is made up of a medical doctor, a nurse midwife, village health worker, and a laboratory technician. This health initiative was conceived to address the wide disparities in health and health services between dwellers of the urban centers and the rural poor, as demonstrated by the baseline survey conducted in 2008 by the FCT MDGs Project Support Unit. Solve existing health access problems due to factors both natural and preventable in the midst of available technology, and adopt new technology, ICT, to improve on the very poor status of primary healthcare management information system through partnership with the private sector. The e-health component now links 12 public secondary healthcare facilities, 13 primary healthcare facilities, 2 private hospitals, and 24 MLIFA teams for a seamless two-way referral operation to a central web portal, www.ehealthng.net and www.ehealthfct.net. This is aimed at achieving a seamless and efficient integrated FCT health management information system, in line with the current effort of the Federal Ministry of Health in using information and communications technology to transform the healthcare system in Nigeria. MLIFA has been able to reach over 400 communities, surpassing the initial target of 336 communities, delivering free medical services, and since inception has seen and treated over 75,000 cases of tropical diseases. MLIFA was noted at the 53rd session of the National Council on Health in the health service category as a special health program in the FCT in March 2010 and was recommended for replication across the 36 states of the Federation at the 55th session in July 2012. It has received several international and local awards, including the Intel Corporation Worldwide World Ahead Recognition Award and the Best Rural Health Practice Award by the Federal Ministry of Health in 2011. MLIFA clustering design has informed government of static PHC structures construction in the 52 MLIFA clusters. At the moment, 30 prototype PHC facilities with staff quarters are at various stages of completion, while additional 12 will be added by 2013. These will serve as static operational base for the MLIFA teams in the clusters and ensure access to healthcare within 5-kilometer radius. Stay tuned for a tour of FCT MDG's primary healthcare clinics and hear from those who run it in the local communities. Bringing healthcare closer to the people is the overall purpose of constructing 30 primary healthcare centers. spread across the 6 area councils of FCC. Most importantly, however, the medical personnel that will man these clinics have been put into consideration through the provision of a block of twin one-bedroom semi-detached flat behind each clinic to house the doctors and nurses and ensure the beneficiaries of the FCT MDGs healthcare initiative get medical attention round the clock. These PHC facilities will also serve as static operational base for the Melafia teams.
These PHCs are now serving as static operational base for Melafia, especially in the course of Melafia services in the rural area. You know, if there is an emergency case, a case they cannot handle, they, of course, naturally refer them to these PHCs that are existing. So, in a way, integrated services.
There are a total of 30 new primary healthcare facilities spread across the 6 area councils. Of this number, 18 PHCs have been completed and operational, with volunteer medical personnel comprising of 1 doctor, 1 nurse midwife, 1 community health extension worker, and 1 laboratory scientist. The remaining 12 PHCs are currently under construction at various levels of completion. We visited 2 of the fully operational PHCs located in Kogo, Bari Area Council, and Kuchiako in Kuje Area Council.
This patient was brought in this morning with complaints of vomiting, stooling, and cold, and then on examining her, she was found to be dehydrated, and we're managing her for acute gastroenteritis. So we needed to admit her and resuscitate her with intravenous fluids and other medications that we're giving her. Our operations, we have outpatient clinics on Mondays, we have immunization on Tuesdays and on Thursdays, we have antenatal days on Wednesday, and then also we have the days we go for our outreaches and home visits. So the turnout of patients also has been very good in this past months. In the OPD, from the time this facility became operational, we've had over 1,400 cases so far from our records. And then the antenatal clinic also has been very functional. We've had some deliveries even in the facility. Even this morning, we had 1 delivery, and we have another patient that is currently in labor. So the operations have been to full capacity, I'll say, so far. We have a functional lab, we have a pharmacy, and everything has been working.
Where we are now is Kuchiako PHC. As you can see from the background, the patients attending immunization. And part of the component of PHC is immunization. Of course, definitely, with good immunization, it will improve child health. Yes, and when we went round, you could see a case of delivery. And as I'm talking to you now, this PHC has taken 7 deliveries this month. And in totality, 87 cases have been seen since the inception of this PHC, ranging from malaria cases, typhoid, acute diarrhea diseases, and the rest of them like that. And we are supposed to have 434 primary health care clinics in the FCT. Only about 176 is available, and FCT administration deemed it necessary to construct 30 new PHCs. And for this year, 2012, we are going to add additional 12. Of course, this will address the poor health indices as regards maternal and child health.
A total of 3,996 cases have been attended to at these PHCs since June 2012. These comprise of 2,159 malaria cases, 147 people were treated for typhoid fever, 253 were treated for diarrhea, upper respiratory tract infection cases were 307, skin diseases were 49. Adequate antenatal care was given to 869, while 212 patients came in with other illnesses needing prompt medical attention. Female patients were 2,366, or 63% of the total, while male patients 1,407, or 37%. 120 deliveries have so far been taken. 5,160 children were immunized. A total of 1,133 laboratory investigations of all sorts were carried out, and 28 patients were referred to secondary facilities for further care. Medical equipment have been supplied to these PHCs, as well as drugs, consumables, and laboratory materials. They are currently on a drug revolving fund to ensure availability and affordability of qualitative drugs in a sustainable manner. But these achievements are not without challenges.
The terrain is so difficult. Even with the use of our mobile vehicle, that's the hillocks, we still face this challenge of pushing our cars. Sometimes it goes stuck to the mud, you know. And some completely, especially during the rainy season, completely will be cut off, you know, because of the stream. You get to the stream, you cannot cross to the community, we have to go back. You know, and we realize again that some medical volunteers that we recruited, some of them really do not have passion for real program.
Yes, we have taken care of those areas that have been identified in the 2012 application that we submitted to the Office of the Senior Special Assistant to the President and MDGs. And they have approved that those areas in terms of fencing, in terms of water, in terms of solar lights, in these particular static primary health care centers. And the issue of even personnel, because it's a challenge for us, but we have been able to engage volunteers. And the volunteers are really helping us in providing service in this community. So some of these challenges, they come, but we are already addressing them because we have funding for it in 2012 that we're going to address. Largely, and even under the area council, the local government track, there are some of the clinics too that are going to be fenced, they're going to have water. So I'm sure that all those challenges identified, we will overcome them to ensure that services are provided to our people in the rural communities.
As the target date for the achievement of the Millennium Development Goals gets closer, more clinics have been proposed for construction. The target is that by next year, the Federal Capital Territory should have added a total of 52 PHCs across the 6 area councils. That is, 1 PHC in each of the 52 Melafia clusters across 336 communities in the FCT, fully equipped, with a block of semi-detached one-bedroom apartments for medical personnel, a standalone solar-powered equipment to power the clinic and staff quarters and pump water from the borehole provided for use. The FCT MDGs office is committed to meeting the MDG target and is determined to introduce sustainable innovative solutions to identified problems adversely affecting the health and socio-economic well-being of the FCT communities.
We have really come up with so many strategies to ensure that those MDGs goals 4, 5, and 6 are achievable in the FCT. One of the things we have been able to do is to strengthen the Melafia programs by ensuring that they visit these rural communities to provide services. You know, after the 2008 baseline survey, those gaps that were identified in the rural communities, the absence of primary health care centers, where they even exist, there are no personnel. So what we have decided to do is to ensure that the Melafia team visits those rural communities and provide these services. And we've also been able to provide 30 primary health care centers and provide them with drugs on a revolving fund so that patients, by the time they get into this hospital, they get prescription, they can buy their drugs from the clinic And the fund generated by this clinic is used to run the clinic, so that at any time you go to the clinic, you find drugs whenever prescriptions are provided by the medical team. So these are some of the strategies we've actually put in place to ensure that the rural communities have all the access to health facilities, because the FCT administration has been able to invest a lot of funds on the secondary and tertiary health facilities. That is why we have concentrated on the primary health care facilities in the rural communities.
The pilot community-based health insurance scheme in the Federal Capital Territory is now leveraging on the successes of Melafia in most of the communities. Presently, 10 communities are in the first phase of the pilot scheme, while 10 more communities are currently being incorporated into the second phase.
If the household in the community can contribute 1,500 and government is bringing 13,500 naira, it's a welcome development. And many communities have shown interest. You know, they've been contributing and wanting us to reach them. You know, so basically, that's it.
From the investment we are having on the MDGs and what the statutory budgets of the FCT is doing on health, I'm definitely sure we'll get there. We'll get there and achieve the MDGs, hopefully.
Join us again as we focus on how the FCT MDGs community-based health insurance scheme is breaking new ground in health delivery in Nigeria.